1. When designing curriculum for the Basic and Clinical Sciences Examination, BCSE, which principle of adult learning is most important for integrating case-based scenarios into test preparation? A. Emphasizing rote memorization of disease lists. B. Encouraging learner autonomy and self-direction. C. Prioritizing only recall-level questions. D. Focusing solely on instructor-led lectures. 2. In evaluating student readiness for the BCSE, which formative assessment method best aligns with adult learning theory? A. Weekly high-stakes exams. B. Peer-led case discussion groups. C. Timed multiple-choice quizzes only. D. Instructor-only oral assessments. 3. When developing MCQs for BCSE practice, which feature most improves validity? A. Using vague distractors to challenge recall, including all options that are equally plausible. C. Writing questions tied directly to clinical competencies. D. Randomly generating items from unrelated fields. Or, which evaluation approach most effectively identifies a candidate's ability to apply pharmacology knowledge in the BCSE? A. True-false statements about drugs. B. Recall of drug names and classes only. C. Case-based questions requiring dose adjustment decisions. D. Matching terms with definitions. 5. A mentor preparing a student for the BCSE emphasizes reflection after each practice test. Which adult learning principle does this approach reinforce? A. Passive memorization. B. Experiential learning. Avoidance of feedback. D. Surface-level review. 6. In a clinical mentoring session for BCSE candidates, the mentor uses real patient records, de-identified, for teaching. Which concept is being applied? A. Simulation learning. B. Contextualized knowledge transfer. C. Standardized rote testing. D. Regulatory non-compliance. 7. To align with regulatory compliance when designing BCSE preparation curriculum, instructors must ensure: A. Test content is based on outdated references. B. Questions reflect recognized, evidence-based standards. C. Content avoids established clinical guidelines. D. Evaluations are completely unstructured. 8. During mentoring, a candidate demonstrates consistent errors in interpreting lab results. Which communication strategy is most effective for correction? A. Delaying feedback until final review sessions. B. Providing immediate, constructive, specific feedback. C. Ignoring the errors to preserve confidence. D. Using only written feedback without discussion. 9. Which curriculum design principle ensures BCSE content covers both breadth and depth of basic and clinical sciences? A. Narrow focus on only anatomy and physiology. B. Random selection of isolated facts. C. Integration of foundational and applied sciences. D. Exclusive emphasis on test-taking strategies. 10. Which method of peer evaluation best supports BCSE candidates in adult learning environments? A. Anonymous critique without dialogue. B. Structured peer review with guided feedback. C. General comments lacking detail. D. Sole reliance on instructor assessments. 11. A BCSE instructor wants to ensure fairness in testing. Which strategy best reduces bias in exam items? Avoiding cultural or linguistic references unrelated to science. B. Using colloquial terms only familiar to certain groups. C. Creating questions based on personal clinical anecdotes. D. Allowing test takers to rewrite confusing questions. 12. When developing outcome measures for BCSE preparation, which metric best demonstrates mastery of applied physiology? A. Number of flashcards reviewed. B. Ability to apply physiological principles in clinical case studies. C. Hours spent attending lectures. D. Self-reported confidence. 13. Which communication approach strengthens candidate understanding during BCSE mentoring? A. Active listening and clarifying questions. B. Providing lengthy monologues without interaction. C. Limiting discussion to yes/no answers. D. Avoiding open-ended dialogue. 14. For adult learners preparing for BCSE, which instructional strategy enhances long-term retention of pathology concepts? A. Repetition without context. Integration of pathology with real-world case analysis. C. Memorization of textbook passages. D. Passive lecture-based delivery. 15. Which evaluation format best assesses higher-order clinical reasoning from BCSE? A. Recall-based matching. B. Multiple-choice scenario-based items. C. Fill-in-the-blank questions. D. True-false statements. 16. In a BCSE mentoring context, which practice most effectively supports self-directed learning? A. Mandating identical study plans for all learners. B. Encouraging individualized goal setting and reflection. C. Restricting access to diverse resources. D. Requiring strict adherence to instructor's outline. 17. A mentor uses questioning to guide a candidate toward independently solving clinical scenarios. This reflects A. Didactic instruction. B. Socratic teaching method. C. Passive knowledge transfer. D. Directive lecturing. 18. Which principle of adult learning emphasizes that BCSE preparation should connect to the learner's professional goals? A. Irrelevance of content to practice. B. Immediate applicability of knowledge. C. Learning in isolation from clinical context. D. Relying exclusively on hypothetical exercises. 19. To ensure regulatory compliance, which practice should be strictly followed in BCSE training programs? A. Using unverified case data for practice. B. Following official testing body content outlines. C. Relying solely on informal study guides. D. Designing items from personal preferences. 20. When providing evaluation feedback to BCSE candidates, which approach aligns best with adult learning principles? A. Delivering delayed, generalized commentary. B. Giving timely, specific, actionable feedback. C. Avoiding discussions of mistakes. D. Offering only numerical scores. 21. Which of the following best exemplifies mentoring in BCSE preparation? A. Dictating correct answers without explanation. B. Guiding learners to analyze reasoning behind choices. C. Limiting mentoring to content recall. D. Avoiding candidate questions during review. 22. In curriculum design for BCSE preparation, which structure best balances assessment and instruction? A. Continuous integration of formative assessments with teaching. B. Separation of assessment from learning activities. C. Exclusive reliance on summative assessments. D. Absence of structured evaluation. 23. Which communication strategy prevents misunderstandings during BCSE mentoring sessions? A. Encouraging clarifying questions from candidates. B. Using jargon without explanation. C. Delivering information without checking comprehension. D. Avoiding dialogue during teaching. 24. An instructor designing BCSE prep material ensures that items reflect real-life case complexity. Which quality standard is being met? A. Reliability. B. Validity. C. Convenience. D. Randomization. 25. A mentoring program includes reflective journaling for BCSE candidates. This supports A. Passive content review. B. Metacognitive skill development. C. Rote memorization of test items. D. Standardized response training. 26. When assessing clinical sciences knowledge for BCSE, which tool best measures applied decision-making skills? A. Flashcard recall quizzes. B. Clinical vignette-based multiple-choice tests. C. Matching laboratory values. D. True-false recall checks. 27. In mentoring BCSE candidates, the most effective way to build confidence while correcting errors is A. Balancing constructive criticism with recognition of strengths. B. Focusing exclusively on weaknesses. C. Ignoring errors to maintain morale. D. Delivering negative feedback without context. 28. An effective evaluation rubric for BCSE preparation should prioritize A. Transparency and alignment with learning outcomes. B. Complexity beyond candidate comprehension. C. Vague criteria to allow interpretation. D. Focus only on quantity of responses. 29. To foster lifelong learning in BCSE candidates, a mentor should A. Emphasize adaptability and continuous professional development. B. Limit instruction to current exam content only. C. Discourage exploration beyond the syllabus. D. Provide fixed routines without flexibility. 30. When preparing adult learners for BCSE, which principle ensures active engagement? A. Incorporating collaborative problem-solving exercises. B. Assigning only silent reading tasks. C. Limiting practice to lecture recall. D. Using one-way content delivery.